Hi, my name is Cheryl Hoffman and I'm a member of the UCLA Interventional Radiology team. I've been asked to speak with you today on varicose veins and chronic venous insufficiency. It's very common, women more than men, and heredity is the #1 contributing factor. Of course, if you're pregnant, obese, and you stand too much, it can make it worse, but remember, it's heredity that is the #1 cause of this venous abnormality. How do we know you have venous disease? Well, at the end of the day, the symptoms are worse. What are the symptoms? Heaviness, pain, cramping, swelling, edema. Gravity is pulling on those venous structures and on the venous blood, and it's pooling in your legs all day long. In fact, most people tell us that at the end of the day, they can't wait to get their legs elevated, and that helps relieve the symptoms. How about if the pain and discomfort is severe and been present for a very long time? Well, then we have skin discoloration and eczema, lipodermatosclerosis, which is a long word, but it really means a hardening or fibrosis of the fat and the skin, and of course ulceration, which is a sore, which is what we definitely do not want you to ever get. When we walk, the calf contracts, and that pumps our venous blood back up towards the heart, so walking is really good for you to do. When the veins become dilated, they become redundant and tortuous, and we get this varicose appearance, as you can see here. These are large varicose veins, greater than 3 to 4 millimeters. These are smaller reticular veins, 2 to 3 millimeters, blue. And how about these, the small spider veins, which are much more common? The great saphenous vein runs along the inside of the leg between the groin and the ankle and is commonly involved with varicose veins, oftentimes in this area or in the thigh. The small saphenous vein is also common with reflux seen in the back of the leg and varicose veins in the back of the calf. We do a detailed history and physical. We get a detailed duplex ultrasound to map all the veins of your legs. This is the history form that we take, and you can see all the symptoms as I showed you, and elevating of your legs. It's very detail oriented. And these are our beautiful ultrasound examinations where the techs draw out what is refluxing and what is not. They give us reflux times, and once we understand what's really happening in the veins of the legs, only then can we make a good determination about what we can do to help you with your swelling, varicose veins, etc. We classify you based on your clinical findings and your physical exam, and we note what are the exact problems that you may have. Do you just have varicose veins? We can treat those. Do you have venous eczema, where there's varicose veins and then scratching and rashes? Or is there severe skin changes with the redness and whiteness in this area where the great saphenous vein ends? And if there's reflux, there's been too much venous blood in this area? Or how about this poor patient over here with a weeping venous ulcer that really hurts a lot? We treat this venous abnormality with heating techniques using radiofrequency or laser, or we can use sclerotherapy and what's called a roto-rooter device, mechanical chemical ablation, where we disrupt the inside of the vein and get it to close that way. Sometimes we pull the veins out using phlebectomy, sclerotherapy, where we inject the veins. Compression stockings are used after all these procedures, and they're also used before these procedures. They're really terrific for your legs. It's like going to the dentist, where you get numbed up, and then we do something, and then you go out as an outpatient, you drive yourself there, drive yourself home. That is what these procedures are like. There's no need for a big operating room or general anesthesia or anything along that. It's an outpatient procedure, very well tolerated by patients, particularly because we use lidocaine creams and lidocaine injections everywhere. This is the roto-rooter device that I was telling you about, where we disrupt the inside of the vein, use sclerotherapy to get the vein to close. Phlebectomy, we make small little incisions and pull the veins out. There's no sutures needed. And here's sclerotherapy, where indeed we inject the small veins and get the veins to close that way. Compression stockings are fabulous. They really make legs feel great. Anti-inflammatory medications are sometimes used after some of the heating procedures, and we do a follow-up ultrasound to make sure everything is closed and there's no abnormality. Here's a before and an after again, varicose veins, and after one procedure here where we closed the great saphenous vein and took out some of these veins here, he got a beautiful result. And how about this? This took about 2 or 3 procedures, not too many, to get the venous blood to not be pooling in this area. It allowed the inflammation to go down and this ulceration to heal. And you can see the after. A lot of pain, no pain. Doing just great. So, the UCLA Varicose Vein Clinic is a comprehensive vein clinic, detail-oriented, IAC certified. We're in Manhattan Beach and Santa Monica, and we can be reached at this number. Thank you so much.